Good morning. And thanks for coming on a beautiful morning. We'll get you out of here into it soon enough. But I think that patients who have age-related macular degeneration are interested in the here and now, but they're also interested in their family and how it affects them as time moves on. Because always we're a product of our genetic code. And so I'd like to try to go over what we know about genetics in brief, and then what it means to you and to your family members as time moves on. And as Dr. Shu mentioned, macular degeneration is the leading cause of severe central visual loss, legal blindness, not total blindness. It's 50-year-olds and over, and it has tremendous social and economic impact because the numbers are increasing because every night you hear it on the news, Medicare, Social Security going down because our population is maturing at an alarming rate. And so if you look at the incidence and the prevalence of macular degeneration as people mature through life, when you're in your low 60s, it's pretty small, and then the curve just really ramps up over time, and especially as we get into our 80s and above. And about a month ago, I was talking to somebody earlier. I was in our Marlton office, and I had 10 people who were 90 or above in one day. And I think half of them drove in. And so when I was 15, I thought 30 was old. So that's... And now it's, I asked somebody yesterday who was 92, we had a full head of hair and drove in. I said, did you ever have that expectation? He said, are you kidding me? Never. So, but they're still having fun, and quality of life is really tied into your visual sense. The projected prevalence of advanced macular degeneration in 2000 was a little under 2 million people, and that's going to ramp up by 2020 to almost 3 million people. As Dr. Shu again mentioned, the eye is like a camera. You have a lens in your eye, which becomes a cataract as it gets darker. It's a focusing device. But that light has to be focused on something, and that is the retina. And the retina really, if you take a bowl and you line it with saran wrap, the saran wrap's the retina, and it really comes very anterior into the eye, which is your far peripheral vision. But right at the base of the bowl is the macula. And that's only about 5 to 7% of the surface area of your retina. But like the thumb on your hand, it may be one finger, but if you lose the thumb on your hand, you lose about 85% of the function of your hand. And if you lose your macular vision, you become legally blind. Your ability to read and drive is lost, although you can get around independently otherwise. And it's just the little center of the retina, and it's specialized neurologically for sharp reading and driving type vision. As you mature through life, and this is a younger person here, you'll start to see within the macula that you'll accumulate these little deposits, and we call them drusen. And drusen is a German term for pebble, and they look like little pebbles. And if you look at them in cross-section, they actually are these lumpy little cobblestone-y type things. And as you mature through life, just like gray hair and wrinkles, you accumulate more. And we can assess risk based on the accumulation of drusen, and even 1 or 2 large drusen is significant in risk. And then also these pigmentary changes that you start to see more in the center. And I'm sorry it's not real dark in here. As you mature through life, those changes can increase your risk of getting macular degeneration, and of course then you have the bleeding and end-stage scarring. So how do we assess risk? How do you assess risk for yourselves and for your family members? Well, there's a little bit of a brew that goes on here. First, the appearance that we just went over, we call the phenotype. That's the way your eyes look when we look at you in examination. 2, age. Age is the #1 risk association. The longer you live, the greater risk of anything happening to you goes up, and in the eyes, macular degeneration is #1 by far. And then you look at modifiable risk factors, because these are things you can do to help yourself. Smoking, bad, 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 bad. And obesity, bad, not as bad, but bad. And all these have to do somewhat with your genetic makeup, because age is, if you live into your 90s, you'll find often that a lot of family members live into their 90s, because longevity is also an inherited aspect. And again, the longer you live, the greater risk there is. And you can take all these things and put them into a little pie chart and evaluate them, and you can see relative risk. So the way you look is almost 50% of your risk, but your genetic code is also a big chunk of the remaining. And then you have things like your age and then your environmental factors. And so getting back to Genetics 101, you're a product of your mom and your dad, and then multiple generations that pass before you, passing along little bits of genetic code that come in. So if you have a mom and dad who have a certain genetic type, and then they're going to pass certain amounts of that to one child and less to another, or the complete risk to somebody else. And that's because we have chromosomes, and we have 23 pairs, and one half of it comes from your mom and one half comes from your dad. And so when you look at these things, they have these little X-like structure, and each of those little bands is a gene. And when you unwind these things, the genes then code for what your body's going to do. And over time, that's going to tell you how your body's going to respond to a lot of things, from cancer risk to macular degeneration to body height, size, hair color, etc. But there's also environmental factors. And so if you have bad habits, if you have sun exposure, blah, 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 your chances of having certain things go up. But your genes are your genes, and that's what you carry through life. So you have these different genes, and it's not like blonde hair and blue eyes where it's just one gene. In macular degeneration, there are multiple genes. And there's one group called the regulators of complement activation. And that has a lot to do with a lot of things, including hardening of the arteries, Alzheimer's disease, etc. And so these conditions have a lot of similarities. And so, and there's a bunch of them. And I won't bore you with the names because I look at these designations and I get a headache. But what the thing you want to take away is they connote risk. And so if you have them, your risk profile goes up. So if you have regulators of complement activation genes, your risk may be up 3 to 4-fold. If they have the ARMS2 gene, your risk may be 25 times higher than somebody else who doesn't have that gene. And then if you smoke on top of it, then you get what we call gene amplification, where you really ramp these genes up. First, you have the risk of getting the problem, and then you do something to yourself like smoke, or you're really overweight, and then these genes just go out of control. So we can't modify our genetics yet, but we can avoid amplification of gene risk by making healthy choices. And again, smoking, just bad, 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 and obesity. And then we can modify the risk by putting things into ourselves that are more healthy and reduce the risk. And that's what the AREDS vitamins are about. So how can we know about our genetic code and what our risk is? And there are genetic testing kits, and they're verified. And so we know that they have a certain risk, and that's pretty reproducible. The problem, as always now in medicine, who pays for it? And they are expensive. And yet they are important, but their full meaning is still to be elucidated. And that's because there's a lot of customization. Not everybody is built the same, even within macular degeneration. What we're finding out now, seemingly, is that the vitamins, for example, the AREDS vitamins, may need to be modified for individuals based on genetic codes. So certain people who have certain genes may not benefit from the vitamins as much as people who have other genetic risk factors. And as we move along, that's going to be fleshed out a lot more, and then you're going to see customization of vitamins for specific groups of people who have specific genetic risk. So what's the benefits of knowing your genetic profile? Well, again, you can create a predictive model that assesses your individualized risk, and that'll lead to more healthy lifestyle choices, hopefully, for you. And then vitamins and their modification and surveillance. The 4C Home people here have hyperacuity meters, and then people who might have really, really high risk would benefit from home monitoring. And then you can discuss family risk. And all those things, of course, are important to any groups of people, especially as we live longer and healthier with a better quality of life. Vision is directly tied into all of that. Thank you.